can't get up. Like normally, I don't think about it. And then now I'm thinking about it.
About having to stand up from
Yeah.
a seated position.
There's a difference.
You hear that, folks? For those of you that maybe didn't hear her, she was cleaning her bathtub and hurt her back. It stood up straight and hurt her back. Now she sits all day for work, and when she goes to stand up, it's hard for her to stand up straight. And I'm going to explain what that is. Okay, that's called FACET syndrome. And a lot of us have it because a lot of us work in front of a computer all day that sit. You know, many of you are watching this video, you're sitting right now, just like I'm sitting right now. Luckily, my job, I'm moving a lot. My job is active. But the reason why you have a hard time going from a seated position to standing upright and then straightening up is because your back is in hyperextension in a way, right? So you're putting a lot of, the facet joints are on the back of the spine, and you're putting pressure, compressing them when you sit all day. And when you stand up, it's kind of hard at first to get upright because your body says, wait, if you go back this way and stand upright, you're gonna put it into more extension, and it's already an extension. And that's why we do the flexion distraction technique in my office, but we're not in my office. So we don't have flexion distraction technique, but I'm gonna show you guys how you can not mimic it, but help with a situation like that. So come on over here. You're gonna put your hand here, okay, and then you're gonna grab your ankle and bring it behind you and do the runner's stretch like this. Grab your left, yep.
See, this is the part.
Okay.
It's
Whoops.
my
And you want to make sure they have something to hold on to.
Right.
For those of you that didn't see it, she almost...
Let me do my right hip. See? It's all tight.
There you go, okay. So she's doing the runner's stretch, and she's just grabbing her ankle behind her buttock and stretching her quad like this, like you see me doing right here, okay? What that's going to do is it's going to stretch her quads and hip flexors, and that's what you're contracting when you sit all day. And that's also going to pull your pelvis into flexion, which is going to do what to your spine above that? Put it into extension. Exactly. So when your hips get tilted forward, your lumbosacral joint right here goes into extension to compensate for that, okay? So you want to stretch your quads and your hip flexors. So that's a great stretch, you know, just to do like a lunge forward where you stretch the hip flexor. Yeah, it's a good one. And I've done videos on this lower cross syndrome, it's called, okay? Yep, so if you Google lower cross syndrome, you'll see information all over the internet about it. And then you also want to stretch these muscles. So come on up here on the table and you're going to do the child pose. Okay. So with her condition, so come up onto your knees. You know the child pose? Yep. And lean forward. And you see here, you know, you want to make sure that she brings her butt down onto the heels like this. And good. And breathe in and out. You want to hold that for at least 30 to 60 seconds. Good, and you can also tilt left and right if you want. So you can take your left arm and reach for this corner over here. And breathe in and out. And then later you can reach that hand over to this corner, yep. So what she's doing right now is stretching her back muscles, and then she was also doing the runner's stretch, which is this one, right, to stretch her quads. Those are the two stretches you want to do if you sit down all day in front of a desk and you have back pain and it's hard for you to kind of stand up straight, okay? It's also an indication you may have spinal stenosis as well. But other than that, the next thing you want to do is strengthen the other muscles, the antagonists to those muscles. So you want to strengthen your abdominal muscles, which are the antagonists to the back muscles that she's stretching right now. And then you want to strengthen your hamstrings, which are the antagonists to the quads. So if you sit down all day at work and you have back pain and it's hard for you to stand up straight, you're gonna stretch your quads and you're gonna stretch your back muscles like she's doing. You're gonna strengthen your abdominals and your hamstrings, the back of your legs. I hope that's clear. I hope that helps you guys out. If you have any questions or comments, make sure to comment below. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.